Let's learn some high-yield physiology. Today's topic, innervation of the bladder and micturition control. Micturition is the process of releasing urine. It's also known as voiding, peeing, or going number one. The bladder is the organ that controls micturition. The bladder wall contains smooth muscle called the detrusor muscle, which relaxes so the bladder can fill with urine and contracts so the bladder can squeeze out the urine during voiding. The urine exits the bladder through the urethra. This is regulated by two sphincters. The internal urethral sphincter is smooth muscle. The external urethral sphincter is skeletal muscle. This process is regulated by the parasympathetic, sympathetic, and somatic branches of the nervous system. The parasympathetic regulation is by the pelvic splanchnic nerve. Its neurotransmitter acetylcholine binds muscarinic or M3 receptors on the detrusor muscle. This is going to cause contraction of the smooth muscle so the bladder squeezes and forces the urine to exit. So the effect of the parasympathetic system is to promote micturition. The sympathetic regulation is by the hypogastric nerve. It also innervates the bladder wall, but the neurotransmitter here, which is norepinephrine, binds beta-3 receptors. This binding causes relaxation of the detrusor so the urine doesn't get pushed out. The hypogastric nerve also innervates the internal urethral sphincter. Here, the norepinephrine binds alpha-1 receptors, causing contraction of the smooth muscle. So this clamps down the urethra, which further prevents any release of urine. So the effect of the sympathetic system is to prevent micturition. The somatic or voluntary regulation is by the pudendal nerve. It innervates the external urethral sphincter, which is the only skeletal muscle of this pathway. Here, the neurotransmitter, which is again acetylcholine, binds nicotinic receptors. This causes contraction of the external urethral sphincter, which prevents urine from exiting. So the role of this pathway is to voluntarily hold our urine and prevent micturition even when the bladder is full. So in this way, we can have control on when to release this hold and allow urination to happen. So to recap, parasympathetic system promotes micturition. Think P in parasympathetic for peeing. The nerve is the pelvic splanchnic nerve. It innervates M3 receptors on the detrusor. It causes bladder contraction. Sympathetic system does the opposite. It opposes micturition. The nerve is hypogastric. It relaxes the bladder wall via beta-3 receptors and constricts the internal urethral sphincter via alpha-1 receptors. Both effects oppose release of urine. The somatic system is for voluntary control. The nerve is pudendal, contracts the skeletal muscle of the external urethral sphincter via nicotinic receptors, and is activated to prevent accidental release of urine. Check out the full video on micturition control here, where I also talk about pharmacology and incontinence, and subscribe to learn other high-yield med school topics.